Right, Perimenopause Hub Bitesize. This time we are looking at breast changes.
Yeah, so there's a couple of symptoms that are definitely worth getting checked out for, speaking to your GP, and if necessary, going for a mammogram. And these are things like noticing changes in your skin texture. If you notice any heat coming from your boob, not just because they're warm, if you notice any particular area, if you're noticing any discharge, any crust, if you are noticing like dents in your skin.
Absolutely. And those are all things that you want to be getting checked out by your doctor. And your doctor will take you seriously on that, because breast changes is one thing that they will always take you seriously. Other things that you might find are changing, but that are less potentially sinister, shall we say, is your boobs may get bigger through perimenopause. They may get smaller. They may feel heavier. They may feel generally sore. So if they feel kind of generally achy and tender to touch, that isn't a thing to worry about. It's horrible, but it isn't actually a thing to worry too much about. But just be mindful that, as with all of your body that is changing at the moment, your breasts will be changing, and the things that Jade highlighted are the ones that you need to make sure you take notice of, as opposed to the ones which are more normal, shall we say, such as getting larger or feeling heavier or feeling generally a sort of a dull ache in them.
And when you are checking your boobs, do make sure you're checking the entire area as well as your areola, your nipple, and also just underneath your armpit too, because sometimes lumps and whatnot can form under here. Now, sometimes during perimenopause, we do get cysts that are non-cancerous, but it is always definitely worth getting them checked out for, just to make sure.
Absolutely. So get it checked.